Welcome back to Better Health's coverage here at HIMSS 10, and we're here with Tim Donahue from Sprint. Thank you for the time here this morning.
My pleasure. Thanks for having me.
So Sprint had a big day here yesterday. CEO gave one of the the keynote speech yesterday. How did that go?
Went really well. The feedback from our customers and partners was that it's really nice to see a wireless company coming out talking specifically what it can do for the healthcare environment, and really help. I think Dan talked about the transformation of healthcare, and I think just bringing it to light for people and helping them understand what it can really do to help enable that transformation was received very, very well, at least by the people we ran into yesterday.
Oh, great. Well, so our audience out there, doctors, nurses, patients, all kinds of interested parties out there right now. So Sprint and Health IT, can you connect the dots for me?
Yeah, I think as I look at healthcare, I kind of think of probably the biggest category is, I'll call it remote or mobile care. And I put that in kind of four categories. I think the first one, maybe most relevant to this audience, is the doctors themselves. And, I think we're all used to carrying around smartphones, which Dan talked about yesterday. Thankfully, we don't have the 1982 version here. We have the 2010 version here. But, he talked about an application. And in many cases, our doctors are going from hospital to office, to surgery, whatever the case might be. They also have normal lives. And he talked about an application by MVism, and it's enabled over this BlackBerry device. And I'll just give you an example. He specifically talked about a situation, and the situation was real. It was in Washington, D.C., where a doctor actually looked at an ECG remotely. He was actually at lunch with his family, and a patient had had a heart attack, and the ambulance service was able to send the ECG directly to the doctor. And the doctor could basically, create the treatment plan while the patient was en route to the hospital, and basically did that. And I'll show this on the screen here. I'll let you guys take a look at that. There you go. There's a...
Whoops.
That's okay.
I bumped it.
That's okay. I got it. So, for those of you...
We're covered on patient privacy, right?
there's no patient in there. So, no patient name or anything like that on there, but you guys can see. And then we've got other examples in here where it's an X-ray. It could be an ultrasound. And I think the point is that people always think it's something to come. This is real, and it's happening today. It doesn't all require huge bandwidth. In this case, the ECG is a fairly low bandwidth application. But getting that treatment in place more quickly for a heart attack patient is pivotal. So that's kind of the doctor's office. I think that the second area, I think of it as remote patients. And most of your remote patient needs, they're chronic illness based. And, a lot of times we think that these people have to come to the hospital. In reality, one, they don't really want to come to the hospital. It's lower stress. Dan mentioned this as well yesterday. We partner with a couple of people, Intel Health Guide, American Telecare Inc. And if you look at, when I think of remote patients, they're literally in their homes. And they have a monitor that sits on their desk, and it's an easy monitor. It's actually got big buttons, and it's real easy to run. It has a camera, and we hook diagnostic equipment. It's connected to this monitor as well. It's all enabled on our wireless network. All of the data is transmitted. In many cases, these patients, they just want to check in. The older you get and you have a chronic illness, if you have an irregularity, you want to know that you're okay. Well, being able to check in, actually send vital signs like blood pressure, or using the pulse oximeter, you can do blood oxygen levels. You can test if diabetic. You can take a blood sugar. You can actually hook up a stethoscope. It's actually been used on the space shuttle. You can use a stethoscope and actually listen to heartbeats remotely and see if there's irregularities there in the heart or the lungs. All of that can be done from tens or hundreds of miles away. And it's enabled. What they like about working with Sprint specifically is the ubiquity of wireless. Because guess what? People that are over 65 don't necessarily tend to have broadband connections in all their homes.
Right.
And don't know what kind of technology they're going to have. So they actually use our capabilities today. Now, as you think of the evolution of that space and 4G, right? So Dan talked a lot about 4G yesterday. 4G gives you, and I'll give you some speeds, but I'll give you a relative, 5 to 10 megabits per second, which is probably, 5 to 10 times the speed you get today on a 3G network. So then you can begin to imagine you can do even more that's really live video feed necessary information. And that's what 4G, I think, really will enable in that environment. The other one is ambulatory services, and Dan touched on that yesterday as well. But today, because live video feeds consume so much data, you imagine a world where you have 4G in these ambulances, and the doctor can literally see what's going on with the patient in a real live environment. So the emergency situations. The last one, which really isn't that technologically advanced in most industries, but it seems to be in healthcare, is actually in-home health services. So today, roughly 40 million people are over 65. In the next 30 to 40 years, it's going to be 90 million people over 65. Well, there's a lot of in-home healthcare services that have to happen. As people get older, they need some low-level health needs, and they have some high-level health needs that require in-person. In most industries, we enable a whole bunch of people with, route optimization, GPS tracking, work order information. It's all captured and submitted electronically. But surprisingly, in the healthcare environment, there's a very low adoption rate. So I would say over the last year, we've seen more interest than we've seen in the last 10 years. But if you go to normal field service industries, they've been using these technologies for 5 years. And the reason they're using it is because, one, it's more efficient for the workers. Two, is it allows them to basically, in the case of healthcare, it's a care plan. They document that the care has been delivered. They can verify where they are. They timestamp it. They GPS stamp it. And it can be sent immediately to the billing entity or for reimbursement. Well, that's been going on in other industries for many years, but not so much in healthcare. So I think those are, it's kind of a broad category, remote and mobile, but I think those are the things that are really going to help kind of change the industry.
That's a great start off to the conversation. I have a bunch of questions. I mean, I guess getting back to the EKG and the lab. Yeah. So has Sprint partnered with some EMR vendors, and how does that work?
Yeah. So when you think of anything to do with patient records, what we tend to do is we have and Dan mentioned this as well yesterday, is this very open architecture. We don't really wed ourselves to one ERP provider or to one operating system. We think it's really important. What we do is create interfaces to, all of the leading ERP systems. There'll be Allscripts, Cerner, whoever it might be. That way, we can connect into any of these entities. Now, usually, when you're dealing with a provider, you'll have to build that interface in with them and create that. The great thing is with the advancements we've had in technologies, building those connections back are quite simple. And it's not quite off the shelf, but it's almost off the shelf. And so, MVism is who I referenced in regards to getting that information out to the doctors. But we work with CellTrack, Zora, Telenav in capturing that patient information that goes right back to the billing institutions. And then I talked about Intel Health Guide and American Telecare. All of that data that the patient puts in their home, there's a direct interface to the ERP, and all that data is captured. And the doctor or the clinician can go at any time and reference, any blood pressure that they've taken over any period of time, and no one administered it except for the patient themselves. So, I think we're trying to make it as easy and open as possible on our side. And, I would say in the healthcare space, they've been very, very good about making certain that they're enabling that stuff easily.
So would that be similar from a home standpoint? A patient has a blood pressure machine, and they'd be interfacing into your network. How would that kind of software solution work there?
Yeah, it works the exact same way. So, down at our booth, and, if any of you are watching this and you get the chance, stop by our booth and you'll see American Telecare. You can see actually the patient takes their blood pressure or uses the pulse oximeter. That information automatically goes into the system, into the American Telecare system, which interfaces directly, once again, to Allscripts or Cerner or whatever. So it creates it's a very quick interface that all of these application providers have already created. The difference here is that it's wirelessly enabled, and I think people think, oh, wireless, I can't use wireless. It's not going to be enough. And if you go down there, you'll see with the compression technologies that are in place today, you can do 90% of what you would want to do. And it's not about technology, because if it's just about technology and cost, we will lose. It has to be easy for the patient. And what makes this easy for the patient is you basically bring this box, you set it on their table. they don't have to worry about technology.